Three, two, one. We're live.
Well, good evening. Welcome. We're going to go ahead and get started. Want to give our greetings to the parents and families and friends and guardians, invested adults, any students we might have tagging along this evening. We're so grateful that you would want to spend some additional time with us during our session today. So just want to greet you, say thank you so much. We have a few more people rolling in, and so we'll get started in just a second. I want to let folks know that right now our chat function is not enabled, but we do have a question and answer function for you. So as we go along in our session today, the last half of our session, we're really going to dedicate to question and answer. And so if you have a question that comes up during our time together, please put that question into that question and answer feature, and we'll get to as many of those as we can tonight. We want to make sure that we're available and answering the things that are important to you. So again, for those of you who are just coming in, thank you so much for spending time with us. Greetings to you. My name is Bill Fiala. I am the Dean of Student Wellness here at Azusa Pacific University, and I am a 21-year veteran of Azusa Pacific, just finished my 21st year here. And so really happy to continue to work with the students, the staff and faculty I get to here at this wonderful university. 18 of those years were as the director of the University Counseling Center. So my specialty is mental health, but am pleased to welcome you more broadly on behalf of the Division of Student Affairs. If you were able to attend one of our other sessions, you might have heard a little bit about student affairs, but just as a reminder, our students get to learn from some amazing professors inside the classroom. But we believe that transformational learning doesn't just happen inside of the classroom, that that happens outside of the classroom as well. So our student affairs offices and our staff create the environments and experiences, the programs and services that help students to thrive and develop as whole people. Now, you may have heard that word as well. When we talk a lot about our students here at AP, we talk about thriving. And we believe that students who are well are students who are thriving. We mean by that they're becoming their best version of themselves, that encompasses all that God has created them to be. The Bible says in John 10:10, I've come that they may have life and have it to the full. And that's what we want our students to experience here at AP. We want them to thrive. We want them to have life to the full. In student affairs, we do this, we promote thriving through what we call our 3 pillars of student development. So the first pillar is what we call spiritual formation. And it's important for you to know that at the core of our mission here at APU, it's to intentionally encourage students to develop a Christian perspective of truth and life. That's the foundation of what we do. And so spiritual formation is our first pillar. Our second pillar is student engagement. We know from research that students who experience a sense of belonging, that they are more likely to persist and be successful. It's one of the primary factors in student success. So we're promoting a sense of belonging through student engagement. And then our third pillar is the one you come to hear a little bit more about tonight, that's student wellness. Because we believe that optimal well-being is a prerequisite in order for students to reach their God-given academic and personal potential. So much so that APU provides significant resources, offices, people that you're going to meet tonight that promote and support students' resilience and well-being. So before we get to them, I'd love to pray for our time together, and then we'll introduce you to some of our panelists. So would you join me in prayer? Dear God, we thank you for all who are here with us. We thank you for the students and families represented here. We acknowledge that this is a time for many of anxiety, anxiety about social unrest, anxiety about physical health and well-being. But we're grateful, God, that we can turn to you, the God who created and knows us so well, to set us at ease. God, grant us the peace that surpasses all understanding as we're here in this time together. Help our families to ask the questions that they need answers to, help our speakers to be clear in their responses, and help us to know what you have for each of us to learn in this next hour as we go forward. In Jesus' name we pray, amen. Okay, well, I'm excited to kick this off, and there's going to be several offices you're going to hear from today. Again, if you have questions, We have disabled the chat function, but the question and answer function is available. So if you do have questions that come up during our time together, please put those in that question and answer function. We will be addressing those in the second half of our program. So I'm excited to introduce first to speak a little bit more about student health, my colleague Gidget Wood.
Hi, yes, I'm Gidget. I'm the director of the Student Health Center, and we are very busy getting ready for your students to join us in just about a month and a half. I want to share a little bit about the resources that we have in the Student Health Center. We have a team of a physician, 3 nurse practitioners, a PA, an RN, an MA, lots of us to work towards serving your students to keep them healthy and keep them in the classroom. We see mostly all primary care patient visits. So anything from a physical to a cold to immunizations, women's health, musculoskeletal. Our students tend to have some skateboard accidents and things like that. We do allergy shots. I'll let Dr. Emerson really go more into the COVID questions that everybody I'm sure is wanting to hear. But we do have a EMR, so our students can go on to the My Cougar Health, and anytime, 24/7, they can go on and they can make an appointment to be seen in the health center. And then now we have where they can even check in on their cell phone. So really trying to make it an easy process for them. All visits in the health center are free. We do not bill insurance, but we do not charge to see students. So it really is, regardless of what the insurance they have, Kaiser, Blue Cross, Anthem, they can come in and see us, and we can guide them through any kind of referral process that would need to come from there. We do have a dispensary, so we do have 50 different medications that we can dispense directly from the Student Health Center, which makes it really convenient for students. So if they might need an antibiotic, they don't now have to go across and spend more time picking it up at the pharmacy, and that students love that part. We can send prescriptions across the street to a CVS or Walgreens, but students do appreciate being able to get them in the Student Health Center. I think I'm going to stop there. So following me is Dr. Todd Emerson. He's our physician. He's going to talk to you a little bit more in depth about where we are with COVID.
All right. Thank you, Gidget, and thank you, Dr. Fiala. And Gidget alluded to musculoskeletal injuries. What she didn't say is that we even have people that occasionally fall out of bunks. So we do have some very unusual injuries in our freshmen. But I'm happy to be here tonight, and thank you for joining us. I'm the medical director of the Student Health Center. I'm also a family physician, and I've been at APU for approximately 11 years. Prior to coming to APU, I was a family physician up in Washington for about 10 years. We are really glad that you've chosen to be here this year, and our students, we're so excited to have students back on campus here because we really have missed them. We do want to make you aware of the fact that that we would like students with high-risk vulnerable conditions to actually sign up with the ADR with Carmen Varela. And Carmen is a very good asset to us, an amazing asset, and she has been with us for about a year. And so if you go to the CDC website, you can actually see their website of high-risk vulnerable conditions. Now, most college students we know are going to be perfectly fine because COVID does not appear to affect them very much. Now, one of the things that you can do to help us minimize the chance of having a case on campus is to actually quarantine your student for about 2 weeks prior to coming to campus. And so that's what we're going to ask you to do is about 2 weeks before your student arrives on campus, we'd like you to actually have them quarantined for 2 weeks. How will we handle a case if we do have a case on campus? Well, we're going to work closely with our public health experts. We're going to support students that are in isolation, monitor them daily. We'll test close contacts as well. We do have the ability to do that on campus. So roommates and people who are around them in class will get tested as well. They may need to be quarantined. And if you live on campus, we have isolation and quarantine units that are available. If you live off campus, I do encourage you to actually look at the living situation and think about that ahead of time. How would you handle a case if that were to occur with one of your roommates? And even to evaluate your roommates to make sure that they are in fact compliant and that they're going to follow social distancing and all of that, so that they really don't put you at increased risk. As I alluded to earlier, we do have the ability to test students on campus. At the Azusa campus, we'll be able to do that 7 days a week. We'll be expanding our hours at the Student Health Center, and the regional centers will also be testing students probably about 3 times a week. We'll have the option for drive-up testing if you opt to do that. But if you don't want to, that's fine. We'll also have a location adjacent to the Student Health Center where we'll be doing testing. I would like to encourage you to bring a few things when you come down. For one, it'd be nice to bring your own set of Clorox wipes and try to bring a lot of them. We're going to encourage students to not only wipe down their high-touch surfaces where they live, but also their desk when they sit down to attend class. Obviously, bring a lot of hand sanitizer, and if you can, bring your own thermometer. I think that'd be fantastic. We want students to be doing daily checks, symptom checks, and the county is going to be requiring that as well. And then obviously some cloth face coverings. If you could bring several of them, that would be good. And this summer, you can also get familiar with using the My Cougar Health portal. We use the portal to make appointments and for symptom checks. It's very handy. We send labs there. You can communicate securely with your provider. And so we encourage you to get on that this summer a few times and make sure that you are familiar with doing that as well. As far as students making appointments at the health center, we plan to screen each appointment to make sure that they don't have infectious symptoms. If they do, if it seems like they might, then we will see them at one of the adjacent locations next to the Student Health Center. If they don't have any concerning symptoms, then we'll schedule an appointment for them at the health center. As Gidget alluded to, we have a mobile self-check-in that they can utilize and check in actually before they even come into the health center, and then we will direct them into the health center as well. So we do have a lot of things going on that we're planning for the safe return of your student, and we're excited to have everybody on campus. As I mentioned earlier, we really did miss not having students around the last few months. And now I'd like to introduce you to Carmen Varela. She's the director of the ADR, and she'll take it from here. Thank you.
Thanks, Todd. Hi, everyone. I just want to welcome you to the APU family. I think that you will see that you have made the right choice. We are all excited to go back on campus and excited to work with your young people, all of the students, and help them get through their academic careers at APU. So I'm the Director of Accessibility and Disability Resources, or better known as ADR, on campus. My office is responsible for ensuring that students with disabilities have equal access to the learning environment as well as the campus environment. So in terms of classroom environment and physical access. And the way that we do that is we ensure that students are provided with the accommodations and modifications they need within the classroom and on campus to ensure equal access and equitable outcomes in terms of learning. So just a little bit about my office and how we bring students in and provide services. Kind of the first step is for students to become eligible. So if you have a young person who maybe had an IEP while in high school or a Section 504 plan, you may want to really strongly encourage them to register with our office so that we can provide them with the right types of supports that they'll need to be successful in school. And all they have to do is either give us a call. Right now we're doing emails at disabilityservices@apu.edu. You just have to send an inquiry. Somebody will get back to you and set an appointment with either myself or my ADR coordinator. And then what happens is we engage with each and every student in an interactive process. So the student fills out an application, submits documentation about their disability. The most important part is for us to sit with that student and talk to them about how their disability impacts them within the classroom and what types of accommodations will work to help ameliorate their disability. And so we do intakes in person when that's possible. We do them online via Zoom, Google Chats, and we also do phone appointments. And so that there is not a need for a student to have to come in person to do an appointment and get services. And students are able to send any documentation, all documentation electronically to our office. What we do after our appointment is determine what are the accommodations that the student is going to need within the classroom to help them be successful. We consult with faculty when necessary about the accommodations to ensure that the faculty are clear about the accommodations, and also to get faculty feedback about whether or not an accommodation is the right accommodation and what the learning outcomes are within the class, etc. We issue accommodations in the form of directives or memos to professors, letting them know that there is a student in their class, who the student is, what the accommodation is, but we do not ever share any specific information about a student's disability. We're prohibited to do that on federal law, based on federal law. So confidentiality is of the utmost importance to us at ADR, and respecting our students' confidentiality. We collaborate closely with all of the academic departments on campus, with all of my partners in student affairs, some of who are here, not all who are here today. We work very closely with the health center, work very closely with university counseling and many other departments. And so kind of our stance is to be proactive versus reactive. We kind of like to get ahead of the game, make sure that students are where they need to be, have what they need so that they can be successful once they start their classes. A little bit about our students. And Dr. Emerson talked a little bit about how we don't believe COVID will affect a lot of, many of at least our students, our ADs. The largest percentage of students with disabilities at APU are students with psychological disabilities, which would include mental health, depression, anxiety, etc. Then after that, we have students with learning disabilities. That's the second largest category. We have students with chronic illnesses, orthopedic and mobility impairments, neurological impairments, brain injuries, visual impairments such as blindness or low vision, deaf and hard of hearing, and many other disabilities. These are some of the broad categories that encompass the students whom we serve on campus. And so I'll just talk to you a little bit about the types of accommodations that we can provide our students. The most popular one is our testing accommodation. And so we provide accommodated testing, ensure that our students who require extra time, a quiet location, some students might require assistive technology while they're testing, they might require a computer, it just really depends. We determine that on an individual basis during the intake process, but testing is one of our most popular and accommodations that we provide. After that would be note-taking. We're moving towards using transcription software where students can literally record and transcribe, use AI to transcribe what is happening in the class. So it's like they're recording and then they're getting a transcript of what's happening, and all of that gets saved on whatever device that they're using. That's actually pretty cool. If you want to look it up, it's called Otter. So we'll be moving towards that in the fall. And then there's just a ton of other ones. We do sign language interpreters, real-time captioners, alternative media for students who require Braille and large text, anything else. The ability for students to sit and stand, extensions on assignments, absences without penalty. We also provide accommodations for chapel when those are necessary. And then we also look at our university policies to see when it is reasonable to modify those to ensure that our students have equal access. And so those are just a few of the accommodations that ADR provides to students. We really hope that if you have a young person with a disability, that they'll come and register with our office. I think given these times, it's even more important if your young person has a chronic disability or an underlying health condition to register with ADR, so that we can ensure that they are getting the accommodations they need, that they're safe, that they're able to participate and have equal access and be successful in the coming semester and throughout their career. So thank you, and I'm going to pass it over to Lori Lacey, my colleague, the director of the University Counseling Center.
Good evening. So glad you guys are here. We are just thrilled to welcome you to APU and just so excited to have you as a part of this incoming class of students and transfer students into our university. A big piece of what we do here at the University Counseling Center is help students thrive, especially emotionally, relationally, psychologically. We deeply value their holistic wellness. And so as Carmen mentioned, we partner with a number of different offices on campus to best support our students. We find that students thrive when they are well cared for. And so we aim to provide a number of different services. All of our counseling is free for our undergraduate and graduate students on the Azusa campus. This year, they will be provided via teletherapy, which will be a wonderful way to have a contactless approach to providing support for our students. And there will be accommodations for those who do need in-person counseling or in crisis, and we're happy to provide that as well. But our goal is really to provide a place of safety and security and really to help transition your student well in this season of adjustment. Coming to college is a big change and a big shift, especially even for parents as they navigate that empty nest transition as well. And so we want to be a support to your students and to the families that are a part of our community. We do that in a number of ways. We offer individual counseling for all of our students via individual therapy, and we do offer groups and workshops as well. So we have a number of different groups and workshops that we offer, everything addressing anxiety management, stress management, healthy relationships, how to have healthy boundaries, particularly when you're navigating new roommate situations. Those conversations can come in handy. We do find that being able to tailor our groups towards the needs of our students each semester is helpful. And because of that, we're actually offering a COVID support group as well this fall that will be important for our students to be able to access. To be able to have a safe place to talk about any concerns they're having, any stress or anxiety related to the pandemic. And we'll provide very basic grounding and safety exercises to help them improve their emotional and relational health as they're with us on campus. And to that end, we're offering multiple workshops, even helping students transition into our university. This summer, we're offering 2 workshops. One is tips for parents and helping their students transition well as incoming students to the university. How do we prepare our children to thrive? How do we prepare them to adjust well? What are some tips as a parent that we can do to help guide our students navigate that process as best they can? And then we also have one for incoming students as well on how do we have a growth mindset and tap into that resilience that we all have and see this situation as one of a challenge where we can grow and thrive in the midst of, rather than one that we need to be worried or afraid of, anxious about. So you're welcome to research more of the opportunities that we have on our website at the Counseling Center. We can be found at apu.edu/counseling center. At the bottom there's also links where you can register for those upcoming webinar workshops as well. We would love to see you there. Our goal is really just to be a liaison for you and for your students. So whether that's ongoing mental health needs, if that is just support as you navigate this time of transition, or even if you just have questions of how to support your student emotionally as they transition to the summer, out of summer into school, please give us a call. We would love to be able to talk through that with you and get your student connected to supports once they're with us on campus. So thank you so much. We look forward to talking with you. With that, I'm going to hand it off to Arissa Alvarez, who is our Behavior Intervention Coordinator here at Student Affairs. And Arissa will talk with you a little bit about how we also coordinate with her office to best care for our students as well.
Great. Thank you, Lori. Good evening, everybody. Welcome to this webinar, and thank you for choosing us. And to anyone who is from Washington State, welcome into the journey of going to APU out of state. I was an APU student and graduated 3 years ago. As Lori mentioned, I'm the Behavior Intervention Coordinator. So my role is to assist in APU Cares, and this is a referral system that we have in place where our faculty and staff can submit an early alert if they suspect a student is under distress, whether it's academic or emotional. And we also have this open if a family or friend suspects that a student is potentially in distress, they can submit a referral where one of our offices, either from student affairs, such as residence life or commuter life, campus ministry, depending on what's going on, will reach out to the student and help provide services so that they are able to thrive at EPU. And any academic concerns, we partner with the Academic Success Center, who is able to assist our students with any academic needs and support them in that way. The other thing that I do is, in a way, think about it as a concierge at a hotel, is I help pinpoint different services and resources on campus for our students. So if they come in with a question, I might direct them to Lori's office or Carmen's office or Todd and Gidget's office or any other office on campus. And if they need community resources, then I am also able to assist them getting connected into their community and what might be able to help them best. And so thank you again for joining us, and I'm going to pass it back over to Dr. Bill.
All right. Well, you can see why I was so excited for you to meet all these wonderful people. These are all folks who are amazing at the work that they do, and they are here because they love students and they love APU students. And so rest assured, we have great minds and willing hearts here to make sure that we are giving your students the best care possible. We already have quite a list of questions coming through. For those of you who might have joined us a little bit late, this second half of our time together, we're going to do question and answer. And so the chat function has been disabled, but you should have a question and answer or a Q&A function. So if you have questions, you're welcome to enter those there. We're going to get to as many as we can in the next half hour. And I'm going to start right off the bat with some questions around dorms and residential experience. We have questions about, will the dorms still offer housing this semester? Yes, we are still offering housing through our dorms this semester. The follow-up question to that is, will it be single room occupancy? The answer to that is, that depends. We certainly are taking any requests that folks have coming into the dorms. If they would prefer a single room, they are able to request that, as long as our ability to accommodate that is available. However, we are also still waiting on some guidelines from our state and our county that may cause us to have to do individual rooms, one per student. So we're still waiting to hear the definitive guidelines on roommates. But for now, what we can tell you is we're not going to oversubscribe any of our residences. So there are times when students will want to have 3 people in a 2-person room or 5 people in a 4-person room. We're not going to oversubscribe in that way. We're going to do capacity only. So the most roommates you would have in a dorm is 1. You'd have 2 roommates together. But we are still, again, taking requests. If people have requests and want a single room, we're also waiting on some guidance from the government to determine whether or not we need to do anything different with that. So I'm going to give this next one to Dr. Emerson. Some questions about testing. So how long does it take to get results from COVID testing that you are using if we were to get tested? And do we need to be tested when school starts? Is that something that's going to be mandatory for everybody?
Yeah, good questions. We are not going to require that everybody receive testing when they arrive on campus. We do want people to quarantine for the 2 weeks prior to arrival, and hopefully that will alleviate most of those issues. As far as how long it takes tests to come back, we have several different options. We have some reference labs that we use. Some of them take 4 to 5 days. We have another one that we just signed a contract with that would take 24 to 48 hours. And then we do have a machine that we recently purchased that has pretty rapid turnaround. We can find out results within an hour, but we don't know the supply of the test kits. So we don't know if we're going to have unlimited supplies. The manufacturer has not guaranteed that. So we know it will be an option for some, but we have backup options as well.
And Dr. Emerson, a similar question. You mentioned quarantine. Are there specific rules or guidelines for students around quarantine? Can they do that at home? Does it have to be done in Azusa? Are there specific rules to follow for that quarantine?
Yeah, we like to follow the guidelines from Los Angeles County, which we have on our website, and they're fairly specific. You can, if you live locally, you're certainly welcome to quarantine or even isolate at home. That's actually our first option if we diagnose somebody, is if they live locally, they can, convalesce at home. And if they live on campus, then we do have some units set aside where we can take care of them there. As well. And so we would check on them daily. And basically, there'll have Wi-Fi, so you can certainly continue to, study and communicate and things like that. We will bring food to them if they're in on-campus isolation and quarantine units. Yeah, so if you're off campus, if you live, let's say, with the roommates off campus, then you'll probably need to work out the isolation setup with them. And hopefully, you can have your own room. That's the ideal situation, and your own bathroom. It's not always possible to have your own bathroom. So then, just sanitizing of the bathroom after use is what the county recommends.
Thank you for that. Gidget, I'm going to turn this one over to you. If I have waived the health insurance, can I still use the health center? Is that still a possibility?
That is a great question. It's one that a lot of people ask. Yes, it doesn't matter whether you waive the insurance or you have the school insurance. The health center is open to all full-time students, undergraduates. So definitely, you're welcome.
All right, excellent. Question about the COVID testing again. Was that for all students or recommended just for high-risk students? And who pays for the testing and how are the results handled? Is that confidential? So Dr. Emerson, maybe you could give us some information about that.
Yeah, the results are definitely confidential. It's open for all students. So whether you are graduate or undergrad, whether you have the student health insurance or no insurance, everybody can access the testing, even faculty and staff. As far as the price, the school will be subsidizing the cost considerably. The final cost has not been determined yet, but it will be probably half to a third of what the actual price was otherwise. The nice thing is that most insurances are paying, reimbursing for it as well. So, if you do have a small bill left over, you can always submit it to your plan, and most likely it's going to get paid for. But the university is definitely going the extra mile and has put forth considerable sums to help subsidize the cost of this. So we really want students that get sick to isolate right away, to not walk around and go to class or do anything, but to just go back to their room and just see how they feel. If they really feel like they are sick, then they fill out a form on the My Cougar Health portal, and a provider will get back to you. And if you need testing, then we'll set up a time, let you know where to go for that. And so we really want to remove roadblocks for students so that those that are sick can get evaluated and tested.
Thank you for that. So we have had a couple of questions about where can we request a single room. If you go onto our apu.edu website and you type in our residence life office, there'll be a contact number there and you'll be able to request that through our residence life office. So I've got a few of those. Gidget, I'm going to give this next one to you. It's about medications, and there's been a couple of different types of questions. So do we prescribe attention deficit meds? Can students have their prescriptions for any meds renewed through the Student Health Center? And are medications distributed through the dispensary free, or do you bill those to student insurance? So just some different questions about medications.
Okay, yeah, the dispensary medications, typically they're about $10. It's somewhere right around there, but so that there is a fee for that, and you really can't get reimbursed for that. It is more of a convenience for students. So we always give students the option to, they can get it at the student health center, or we can write the prescription and send it to a local pharmacy, and they can use their insurance card. So that's always an option. As far as attention deficit, we just want to know that students have been actually truly diagnosed with ADD or ADHD. So we would just need that documentation to continue renewing the medications, but that is often, we often do that for students, and because it's a monthly thing, as we all know. So yes, we can definitely do that. I think that was it, right?
I think you got them all. Yes, absolutely. Carmen, you had something that you wanted to mention about single rooms as well. So could you go ahead and mention that?
Yes, so for any student with a disability, underlying chronic health condition, or any other disability which might require an accommodation and housing for a single room, those requests have to come through the Office of Accessibility and Disability Resources, or ADR, my office. So again, I just want to encourage you to encourage your young people to register with our office if that is the case. If they have a chronic underlying condition and feel like they might need their own room, they are given priority in terms of getting their single room, so that we can meet those accommodations for our students. Thanks, Bill.
Great, thank you. So we've had a few questions about, is the school still going to move forward with in-person classes, even with the most recent spikes that have happened in LA County area? And the answer is we are still planning to, yes, but what we've proposed and what we're working on is kind of a hybrid model where students who are perhaps at high risk or who are experiencing symptoms themselves would be able to do online classes while they're not feeling well, or when they're feeling like it's a higher risk time for them. But at this point, we are strongly following guidance from our public health agencies. And at this point, they have not said that we're not able to have classes in person. And so we're moving forward with our plan to be able to do that. Now we're obviously putting together technology and options for students for whom that wouldn't be their best option. And again, specific health, and maybe this is something, Dr. Emerson, that you might be able to shed some light on, because there's a couple of questions about if my student has asthma, for instance, should they stay home and take classes from home versus be back on campus. So maybe you could speak to that specific a little bit, but the short answer to your question is yes, at this point we are still planning on having classes on campus with appropriate social distancing, with appropriate mask usage, and all of the preventive implements that we would hope students would use. Go ahead, Dr. Emerson.
Yeah, I think that, we definitely encourage you to speak with your doctor and find out what is best for your particular situation, since your doctor knows your condition best. In general, if somebody has mild asthma, maybe they don't need their inhaler very often, they certainly don't use it every day, then that person probably is going to be considered lower risk, whereas somebody that, really needs their steroid inhaler and their rescue inhaler every day, multiple times a day, is in a slightly different higher risk category. So if you have the conditions that the CDC lists as being vulnerable, I would definitely talk to your doctor and kind of come up with a plan and see what you think is best for you. But once again, if you do end up deciding to come to campus, then we're certainly happy to help you at the health center and help facilitate even communication with your specialist and your primary care doctor with monitoring your care.
Okay, I am getting a bunch of questions about move-in and welcome week. And so the question really seems to be, are we all moving in all at the same time, or are we going to stagger that? And at this point, the plan is for staggering. So we are going to have what would typically be a move-in day become a move-in week. Now, the details of that are still being worked out in terms of who's going to move in when, and your family is going to get that information forthcoming. But we're going to spread out move-in over the course of the week before classes start. We'll also be doing our welcome weekend activities over the course of that week with much smaller groups and online. So know that we are planning for move-in to be as spread out as possible, so that not everybody's in one place at one time. And again, trying to maximize the preventative implements that we know work well, masks, distancing, those kinds of things. There's been a question about, are there hand sanitizer stations throughout campus? Yes, and more are coming. We are entering into that season where we're getting the campus ready. And so we are in the process of putting in those hand sanitizers in strategic places. We do encourage students to bring their own, obviously, if they can track it down, to have that on hand as well. Okay, let's see. A couple of questions around, if my student comes down with COVID, what is the next steps? Where would they be quarantined? Would they still be able to do classes? How are they going to get taken care of for food, things like that? So Dr. Emerson, would you mind answering that question?
Yeah, we will usually try to encourage people to go home if they live locally. We can certainly help expedite that and make it done safely. But if it can't be done, then we're certainly more than happy to help out. We have some units on campus that are already set up and ready to go. And we'll be monitoring those. We have some devices to monitor remotely with as well. And we'll be communicating with them. Yes, you will be able to attend class and do those types of activities. And, if there's any concerns, we'll go in there and take a look. It's right next to the Student Health Center. And so, yes, you should be able to continue to function pretty normally. Most of the cases we see with this are very, very mild, in fact. And so I think we should be able to take care of you well. And if you need to go home, we can help you with that as well.
Okay, thank you. Some questions about immunizations. Gidget, what immunizations are needed before a student comes in as a freshman?
Okay, good question. Thank you for that question. So students need to have proof of 2 MMR vaccines. And so that is easily, you can go to the My Cougar Health portal and upload those, so you can enter the dates, but then you can also take a picture of your record, and we need to actually have a copy of that as well. So the portal explains very well how to do that. As well, there is a form, it's called the TB questionnaire. That's on the portal as well. And it's a few questions, like 6 questions. You just yes or no to those 6 questions, submit, and that goes directly to us. And our staff is checking those results daily. And so those who haven't done it will start getting phone calls and that kind of stuff. So if you guys can do that now, that would be awesome.
That's great. Thank you for that. We love to get that done sooner than later, so that we're not trying to track students down to get those immunization records. So thank you for that. We have a couple of questions about chapel. And just as a way of advertising, we do have our spiritual formation session next Tuesday evening. And if you'd like to sign up for that, we'll have some information about that for you towards the end of our session today. But as of right now, chapel as it has existed with thousands of students in our event center or our Upper Turner Campus Center isn't going to be happening this fall. We cannot put that many students in a confined space. And so we are working on, and hopefully you'll hear more about this next week if you sign up for that session, we're working on some creative ways. We're not giving up on spiritual formation. This is what is at the core of who we are, is developing our students as Christ followers. And so we are going to have other ways that we address spiritual growth. There will be probably some asynchronous options where people watch chapel videos, or there may be some additional options around small groups, but we're looking at some creative ways to create some options for students where they will not have to sacrifice their spiritual growth, but it won't look the same as it has in terms of that large chapel group. So so I hope that answers those questions about chapel. We are not, and that's going to be any setting where you would have a large group like that. That won't be something we'll be doing on campus this year. That's going to be guided by, again, our public health agencies. But that again, missionally, we're gonna keep on doing spiritual formation and spiritual development, and hopefully our students will enjoy the different ways that we come up with to do that. question about will all students be on campus or just the freshman class? All students. We will continue to have commuter students who are taking classes. We'll continue to have people living in our apartment complexes, continuing to have students living in our dormitories. Let's see, other questions I'm scrolling through right now. What will hybrid classes look like? Hybrid classes will look very similar to, and there's some other questions about what does the classroom look like, right? So our professors are going to be challenged to provide both online and in-person instruction, some of them simultaneously. For some students with specialized areas, acting students come to mind, students with practicums like nursing. The different departments are going to work out the details of that. So if you have specific questions about specific majors, the best place to go for that would be your academic department, your home department. But for students in general, yes, mask wearing, having wipes to wipe down one's seating area. The seating will be 6 feet apart. Will be reduced in terms of the number of students that will be able to be in a classroom at a time. So the classroom experience, again, will also look a little bit different. There will be less students per class. There will be some flexibility in terms of students may be able to do either in person or online or some combination of both. But those are still details that are, again, being worked out. And so I hope that answers to the best of our ability that question. Let's see. Dining services will be similar. Dr. Emerson, one of the things that's come up is daily checks. Can you talk a little bit about that? And that kind of dovetails with that dining question is, will dining services be open? Would you mind fielding that one?
Yeah, the county is going to require us to do daily symptom checks. It is not yet elucidated how that will take place, whether that is going to be on their own or whether there's supposed to be a formal monitoring by the university. There is the ability for us to do symptom checks through the My Cougar Health portal. So when you log in to make an appointment, there would be an icon that you would click to fill out the symptom checklist. And there'd be a reminder that comes each day to remind you to do that. And then once you click the symptoms and so on, if you don't have any, then you get a green go. If you have some concerning symptoms, then you might get a red and need to call the health center and so on. But that is most likely how it will occur.
Great. And just to follow up, Dr. Emerson, there's some questions about contact tracing and what will happen in the event that somebody does have COVID on campus. Will we do contact tracing? What will be the process of, will there be a quarantine for those who have been traced to have had contact with that person that tested positive? So could you talk a little bit about that?
Yeah, absolutely. If there is a case, we will assign that to a contact tracer. We have several, and the contact tracer will then determine who was around them, who the roommates were, and the close contacts will then be tested. Hopefully, we will be able to use our rapid machine to find those results out right away. If they are negative, then they would be asked to quarantine for 14 days. They could quarantine either in our unit that we have set aside. We have several throughout campus, or if they live in a dorm, not a dorm, but if they live in a room, an apartment, and maybe they're by themselves, they could potentially quarantine there as well. And so, so we do have a contact tracer. They will coordinate a lot of this, with the communication with the teachers to find out, which classes have used the room, to get facilities to sanitize the locations, and then to alert people when everything is done and when the rooms can be accessed. So yes, we will have contact tracers.
Okay, great. Thank you for that. There was a follow-up question about move-in. The date for that we're starting classes for our undergraduates has been moved to August 24th. And so move-in will be for most students the week of the 17th. Okay, so just have that date in your mind. August 24th is the first day of class. August 17th will be the first day that most students will move in. Those that have exceptions might be athletes or student leaders, but would typically not otherwise have exceptions to that. Question, Gidget, if a student falls ill at night, is there a 24-hour hotline or somewhere for them to call?
That's also a good question. We do not have an infirmary, but we do have a 24-hour nurse advice line. So students can, if it's 2 o'clock in the morning and they're really not sure what they should do, they can call the nurse hotline, and they will get a registered nurse who will do a consultation with them and then advise them, you know what, it sounds like you could just take ibuprofen and wait till 8 o'clock in the morning to call your health center, or you know what, you've been vomiting all night, it probably would be a good idea to have somebody take you to the ER. So their consultation, we will have extended hours with the COVID thing. We're not really sure how that's going to look, but we will. It will go beyond the 8 to 5, and we will have people, providers, on call during the weekends, but it won't be a 24-hour thing.
Great, thank you. And as we're on the thought of a student having issues at night, we know sometimes there are students who have issues with anxiety or mental health issues. After hours, Lori, can you talk a little bit about what services are available for students with emotional concerns after hours?
Do have a 24-hour crisis hotline as well, where students are able to, at any point in the evening or in the weekends when the counseling center is closed, they're able to call and be connected to a mental health professional over the phone. They will walk them through emergency procedures, but also provide free counseling in that moment, and in most cases able to really help support that student process through their concern, give them some good resolve. And the beauty of that is they send us a report the next day, so when we're back in the office, we're able to follow up with that student, invite them in for a therapy session and follow up and support them for the rest of the semester, or as much as they may need after that incident. So we do have that 24-hour coverage as well. Mm-hmm.
Great, thank you. It's important for us to wrap around as much as we can our students and give them those services when they need the most. So thank you for that availability. Gidget, Lori, both of you, thank you for that. How will you handle visitors to campus? Will that be discouraged? Obviously, and some other questions around here that I'm seeing is how will we basically make sure students are following social distancing, and how are we making sure that students are wearing their masks? That's going to be a community project, right? And it's going to be all of our responsibility, students included. We are going to provide students with some guidelines and expectations at the very beginning of their experience with us here. Those should come out in the month of August, and we sent to students so that they can review those, and we're going to review them with students when they get here in the fall, that those expectations will be that they do wear masks, that they do socially distance, that they are being judicious about campus visitors and so forth. So know that those guidelines more specifically are coming, and know that as staff and faculty, we will certainly be monitoring and encouraging students that we see who aren't following those guidelines to do that, but also know that that is our students' responsibility as well. And so as you talk with your student and prepare them for coming, as we would with any safety issue, we know that college campuses are one of the safest places that a person can be, but that doesn't mean that they're 100% safe. So we want to make sure that our students behave in ways that are safe, that they walk in pairs at night, for example. That's just common sense safety. We're going to lean into our students and ask them to be adults and say, you know, there are reasons why that we're wearing masks. It's not simply that you would get sick. It might be that you could make somebody else sick. And so we want to be respectful as a community, as a Christ-centered community. We want to make sure we're taking care of one another. And part of that is being respectful with following those guidelines that we'll provide to those students. But absolutely, please have conversations with your students about that. Will there be more of a physical presence of campus safety? We wouldn't ask campus safety to be policing, so to speak, mask usage. Our campus safety is to make sure the campus is safe. And so from outside possibility of harm to students. And so our campus safety won't be the ones that will be observing and looking at those things, but our campus safety presence is strong. We have a great relationship with our Azusa Police Department, our Glendora Police Department. We have what's called a university officer, a URO, who basically his beat is our campus. He's an Azusa PD, but his job is to patrol our campus and make sure he's available for anything that happens. Again, a campus is a safe place, but we also don't want to lull ourselves into a false sense of nothing can happen here, and we want students to be wise. So I hope that answers that campus safety question. Will discipleship groups still happen? Yes, absolutely. We will still be doing things in smaller groups. Some of those will be in person and some of those will be online, depending on indoors, outdoors, what capacity is, masking, and so forth. Gidget, a question for you. Can students get their yearly physical exam and regular preventive medical care through the Student Health Center, or is it only for students who are sick?
Oh, good question. Yes, we do a lot of physical. So for particular, some of the student programs, they're required to get a physical yearly. So we do a lot of nursing physicals, we do ROTC physicals. So yes, if a student just says, I need to have a physical, I haven't had one this year, absolutely they can schedule to make an appointment, and we do that, and it's free of charge. So yes.
Great, thank you. I am looking at the number of questions we still have and the amount of time we have left. And so I'm going to apologize now. And I'm going to say we are not going to get to every question. We will try to answer as many as we can that we have not answered already. I think we've touched on quite a few of these, but we'll do our best to just provide a brief written answer before signing off. So if there's a question that you had listed that you don't feel like you've gotten an answer to, we'll do our very best to get those answered. Some of them are about specific dates. When will we find out? In the very near future. I don't have a specific date that we will be notifying of when your student will move in, but know that that week, the 17th to the 24th, is when we would have students move in. So hopefully that at least gives you a window that you can be aware of. That's, again, when we'll be having our welcome week activities. First day of class is the 24th. The name of the local hospital just came through. That is Foothill. It's not Foothill. Gidget, do you know the name? We just had a name.
Emanate.
Emanate, yeah, Emanate.
Emanate, thank you. Yes, it used to be Foothill Presbyterian, now Emanate. It's less than a mile from campus. So we actually have, again, great resources. Being in Los Angeles, we have a wealth of partners in the community that students can access. So gonna look for one last question. Will there be any provision of testing for parents or people helping students move in if they are moving from out of state? Some states are requiring that people be tested on their way back in. Is that something that we would do, or would that be something that we would refer parents and those helping out to another resource? Dr. Emerson.
Yeah, we can certainly try to do that. I mean, I think a lot of it depends on our supplies at the time. There might be a fee for it, but we will do our very best to take care of our parents.
That's great, thank you. Will other big events like homecoming or parent weekend be canceled or modified this fall? You can definitely count on modified. Anything that was a big gathering of lots of people, like a football game, probably there's going to be some modification to that. And so, yes, we want to be able to celebrate our parents. We want to be able to celebrate events with our students. Our campus life team, if you're looking for specifics, will be doing one of these sessions in 2 weeks on the 14th. And so I'd encourage you to sign up and hear a little bit about what our student engagement and campus life teams have in store for our students. We won't be having intramurals this fall. NC2A athletics, we're still waiting on some guidance from the NC2A on what that exactly will look like. But know, again, that we're closely monitoring what we can and can't do, and wanting to make sure that we keep our students in the best space possible and keep them safe. I am going to share a slide with you all. So this is going to be, we've had some folks ask, can we have the contact information of the people that have been on this call? And so I'm going to give you just a second. if you want to take a look at that. All of us are available to be contacted individually. You can certainly go onto the apu.edu website, and we will have additional contact information there. So just know that that's available. But this is all of the different offices information that you have talked with tonight. Again, great questions. We're so grateful for the engagement. If you feel like your question wasn't answered, and you have something specific as a follow-up, please use one of these email addresses and send us that question. We'll be more than happy to answer that for you. Again, we just ran out of time, so I apologize. It wasn't that your question wasn't important. It was that we ran out of time. And so if you would like to forward that question to one of us, we'll be more than happy to answer that for you. Again, next Tuesday, July 7th, we're going to have our spiritual formation team talking a little bit more about chapel, discipleship, ministry, and some of those other options for students. In 2 weeks, we'll be welcoming our engagement team, talking about activities on campus, what life is like for the residential and our commuter students. So know that those are upcoming. And then we will be doing another session on wellness on the 21st. And so if there are more questions that come between now and then, again, you're welcome to email us directly, or you can tune in for that session again as well. So at this point, I'm seeing it's 7 o'clock. I'm going to thank our panelists for being available and for answering questions. And again, we are prayerfully and excitedly anticipating your students on campus. We love students and we love interacting with them, and so are so looking forward to seeing you and seeing your students in the fall. But as we wrap up, just want to say thank you for attending this session. And thank you for entrusting your students to us. We look forward to seeing you. Take care.